Hey guys, and welcome back. Today I wanted to go over one more modality that we use in our clinics, and if you're interested, we have an entire playlist of modalities for you to check out, so make sure you do that. But today we're talking about paraffin baths, so let's get started. So paraffin melted can be used for thermotherapy, and it can be safely applied to the skin at the temperature of around 113 to 122 degrees Fahrenheit due to its very specific heat and thermal conductivity. Why would we use this? Number one, for pain, especially with your patients that have like arthritic changes in the hands and joints of the fingers. This feels amazing to the patients most of the time. Number two, for stiffness. Heat tends to loosen the joints and helps with stiffness in the hand or the digits. Before you start, it's important to have the patient wash their hands thoroughly to minimize any contamination of the paraffin itself. Then have the patient dip their hand with the fingers slightly spread apart, not here, so that it can get in all of the creases, and don't have them move the fingers during the application. I also usually tell the patients not to touch the sides or the bottom of the tank, as this could be a little hotter than the paraffin itself, and we certainly don't want to burn anyone. After a few seconds, bring the hand out of the paraffin, allowing it to drip for a few seconds, and then you're going to dip the hand right back into the paraffin. We typically repeat this until we have anywhere from 6 to 10 dips into the paraffin wax. We then wrap the hand in a plastic bag or some wax paper or something similar to that, and then usually we wrap in a towel to kind of minimize the heat loss and to decrease the mess as well. A typical session could be anywhere from 10 to 15 minutes or until the wax is fully cooled off. Remind your patient not to move the hand during the dipping or the rest period to kind of keep the wax from breaking apart. And after the treatment, you can really easily remove all the paraffin and just discard of it afterwards, throw it in the garbage. One way we like using paraffin bath the most is to tape stiff hand into digital flexion with some Coban or something like that. Usually I like having the Coban come down on the wrist some, because when they stick their hand into the paraffin, if it's just on the fingers, that paraffin's going to kind of loosen the Coban and it'll come apart. So that's just not going to hold for you. But anyway, this is a good way to get a prolonged passive flexion stretch combined with heat, which usually is very beneficial to the patients. So you know how and why and when to use paraffin bath, but of course with just about everything, there's always going to be some contraindications. So let's talk about those. You definitely don't want to put someone's hand in a paraffin wax bath if they have an open wound, a burn, any kind of acute inflammation or significant edema to the hand. So just be careful if you have any of those contraindications. So hope you guys learned something and a way that you could help you yourself or your patients in the future. We'll see you guys next time.